Hello, everyone, and welcome to the Hope Discovered podcast by CommQuest. My name is Bill Deeser. Our show advocates for the principle that no matter what your recovery journey may happen to be, there is a chance for a better life. Recovery is possible. Our guest today is Dr. Ashlie Martin, who is the medical director for addiction medicine at our detox location and for our MAT program here at CommQuest. Dr. Martin, thank you very much for coming on the podcast today. It's great to have you.
Thank you for having me.
Absolutely. MAT stands for Medication Assisted Treatment. Our MAT program dispenses methadone, buprenorphine, and Vivitrol to treat those struggling with heroin, morphine, prescription medication, other opiate addiction, or alcohol use. When used in combination with counseling services, MAT has proven highly effective in assisting individuals in their recovery from specific types of addiction. Dr. Martin, let's kind of start with you. Not everyone here at CommQuest and throughout the community, for that matter, has had a chance to meet you yet. Can you tell us a little bit about yourself and what brought you to CommQuest?
Oh, absolutely. Some things that I haven't actually shared with a lot of people. I know a lot of people know about my diverse upbringing. A lot of people assume that I'm an Army brat because I've lived in so many different places. I've lived in Barbados, West Indies, and Miami, Florida, and other parts of Florida, as well as Cincinnati. I was actually born in Cincinnati, and what brought me from Cincinnati to Florida was not the Army. My mom, in addition to her moving around a lot, but a lot of our moving was kind of escaping. A lot of my family has suffered from a lot of mental health disorders, a lot of addiction, a lot of trauma. And so I lost my 18-year-old brother when I was 8. That was part of a big move that we had when I moved from Cincinnati to Florida. And that was actually, he was a victim of at the hands of the police. He wasn't into any sort of drugs or gangs or any violence. He was just a hot-headed teenager. But the contrast of that is I had an uncle who was very hot-headed, who actually fell victim to his own vices of addiction. And he passed away from a heart attack after overdosing on cocaine in his car. He also suffered from a lot of mental health. So those are things that my mom has lived through and that I've lived through and experienced through a lot of different family members. So going into my journey into medical school, going into medicine, I've always had a heart for and a passion for wanting to care for people. My mom is a retired registered nurse. So she's always kind of been that pillar for our family. She raised 5 of us. Single Black woman raising 5 kids. So she's always been my motivation. Yeah. She's actually also worked in addiction medicine as a registered nurse down in Florida. So, but when I got to the point of practicing medicine, I went to go into family medicine. And I did not envision myself practicing addiction medicine. I actually looked at it as, oh gosh, this is something that I kind of wanted to escape. Growing up, certain drug use and certain alcohol use was sensationalized. Yeah. And I knew that it does run in my family on both sides, addiction and mental health, to the point where as a teenager, as a young 12-year-old girl, I was allowed to drink. I was allowed to, it wasn't something that was frowned upon in my family, even in my household. Now, my mom, since then, does not partake in any sort of substances. But I grew up in a household that drinking was just the norm. So, and it did get the best of me at some points in my life. So when I looked at that population when I was in my family medicine residency, I looked at it and I said, I'd rather get away from that, But then I slowly discovered, and I discovered through one great mentor of mine who, God rest his soul, has passed away since. But he sat me down one day and he told me, he said, why don't you want to, further your experience with being able to service this community? He said, you have a gift. And he set me down and he said, you have a gift to treat this community. He said he discovered how many people were willing to open their stories to me, open their hearts to me. And he said that, I slowly discovered I think the reason why they were able to, because I didn't carry that bias. I didn't look at them as those so many stigmas and so many things that people look at them as. I looked at them just as human.
Yeah.
I have, cousins and uncles and aunts who have the same experiences. I saw them in them. I saw those people. Those are people that I love. These are my family members. So I looked on them as those same people, and I didn't see them as any different. And so they, it just became something that he just kind of first pushed me into. Then I just kind of opened my mind to it. I furthered my training after experiencing that community and working in that community. I finally said, okay, well, I'm committing to this. I went and became an addictionologist. I furthered my training in that. And at the end of that training, the biggest thing that I wanted was to be able to not just treat one side of a patient. I'm family medicine certified. I'm addiction medicine certified. And I've always had that passion for the mental health component, because I know you can't treat one part of the patient without
Correct.
the other. Yeah. So CommQuest, looking at my search looking for that job, I wasn't looking for a job. I was looking for a lifestyle, looking for something that was going to encompass who I am and embody what I wanted to do with my life. I didn't take this job thinking, okay, well, this is going to be a step to the next step. I took this position wanting to embed myself in it and to utilize my gifts and my talents to better a community that I would make my own and to literally plant myself into. Yeah. As soon as I, took the job, I immediately found a house and committed to that house, committed to that community. So this is my community, hands down. Like, this is my community. But CommQuest had every component that I needed in a company. It embodies everything that I needed to be able to continue to progress in my career and to that I can be able to give those services to those clients, the social services, the mental health services, the addiction medicine services, and all those things, because all those things are factors that affect addiction and affect people's well-being and health, minus the family medicine portion, which we're working on that. But I'm still able to treat those components too. I mean, I'm never going to tell someone, no, I'm not going to help you with a rash or, problems with their blood pressure if they come into my office. So.
Right. Sure. Well, you speak to what we so often run across here with nonprofits in general and a place like CommQuest with, our pillars being mental health, addiction recovery, and social outreach. People are here because they believe in the mission. They want to be. It's not, and everybody needs to make money. Everybody needs the lights to go on. That's not what I'm saying. But here, they really dedicated like you are to the community. And I can't believe that doesn't just command a lot of respect for you. And thank you so much for what you do. And thank you for being here.
Thank you.
What is the basic strategy of medical assisted treatment?
So, key word in there, assisted.
Yeah.
So a lot of people think that they can get on a medication and then they're good. Nothing else. Don't do anything else. And the key thing is that you take the medication, but it's a component of the whole treatment. It's not just the medication.
Sure.
So you use that medication in addition to the behavior therapies and the counseling, and those all things are things that work together to help that recovery process. So that keyword is the assistance of it. Some people have that. The understanding that, or the misunderstanding that this is something that there's a cookie cutter effect of how this works, and there isn't. And some people compare like, okay, well, you have to be on a certain dose if you're using this much, and everything is tailored to the individual. So to when you're putting someone on or choosing the medication, everything is not the same for everybody. One person may be using the exact same amount and may require a whole separate different dose of the same exact medicine that even their twin might be using. But the biggest thing is not to depend on just that medication. The components of addiction depends on not just, that chemical, but it's a neurological thing. It's a biological thing. It's a genetic thing. There's social determinants, psychosocial and psychological components that play a role in the addiction process. So we have to take care of all of those.
Yes.
So,
what type of client? And I ask this because, like you said, it's the medicated assisted part is only one component of the whole thing. So, for what type of client is this type of treatment most effective, and are there dangers associated with this type of treatment?
Okay. So, in general, now this is just book knowledge as far as on paper, the people that we reserve MAT for are usually people who have what we consider like a moderate to severe addiction. Usually the go-to is that if you have more of a lesser problem, then you can usually do it without any medication. More severe, meaning it's more affecting your life, meaning it's causing you to basically think about it a lot. It's causing more cravings, causing you to have withdrawals, causing you to have issues with your psychological health or your physical health. Also interfering with your ability to socialize, to go to work or school, interfering with your responsibilities at home, interfering with your relationships. So usually when there are certain components of it that's kind of interfering with your life to certain extents, it's probably ready to start considering that MAT. That's when that medication or whatever particular substance is kind of overtaking the brain, your ability to make those decisions. And it literally does. It does affect the brain. It makes you more impulsive, more compulsive. I say it kind of gives you, no offense to our teenagers, but it kind of gives you a teenager brain where you're kind of that frontal, what they say, that frontal lobe is not, that decision making capacity literally is lowered. The substances are literally causing you to not make those decisions as well as you would if you weren't on them. So once you've got those components going on and that those kind of processes are happening, it's time to probably consider getting that medication. The medication, the MAT, allows that brain to literally cool down. So it gives that brain a break from those substances and allows it to kind of cool off, let those processes to heal. And sometimes, unfortunately, some of that damage is not always reversible.
Right.
But if there's going to be some reversibility, did I just make that word up?
Yeah.
Reversibility, it's going to happen, with being able to give that stuff a break.
Sure. So is there, from what I'm gathering, the process is relatively safe, although any medication, I would presume, has the potential for side effects or something like that. Okay.
Correct. Everything has side effects. I mean, even if you look at a bottle of vitamins, you're going to probably, for instance, even when I start a new vitamin, I get nauseated. So everything has side effects. And just because something makes you dependent doesn't make you addicted to it. There's certain, blood pressure medicines, you're dependent on them.
Sure. Most
mental health meds, there's a dependency. If you stop them, you're going to have side effects. There's some that has the side effects as severe as seizures, even when it comes to certain mental health meds. There's a lot. I can list off hundreds of medications that have side effects that if you stop it too suddenly, you're going to have some sort of withdrawals or side effects. But when it comes to our MAT medications, the main ones that people are usually fearful of are usually the Suboxone and methadone, because they do have those side effects because they are still opioids. Suboxone is what they call a partial opioid, a partial agonist, and the methadone is a full agonist. So there is still, of course, potential, dangers associated with it in combination with other things like benzodiazepines, alcohol, or of course other opioids. You can potentiate overdoses with those. So you have to be very careful, which is why you always want to be taking any of these medications under medical supervision. There's special clinics. Only certain clinics can prescribe methadone, like our own, what they call OTP clinics, but you can't get it everywhere. Of course, unless you're like going to an oncologist or a specialist who is prescribing methadone for pain management or someone. But there's risk for taking, something that still has that potential when it comes to combine, especially with those other dangerous medications. So.
Interesting what you're saying about withdrawal and other things, which kind of leads me into a question about alcohol. Alcohol is one of those kind of things because it's legal, it's readily available just about anywhere. And the idea of taking a drink is with friends, socially, what have you. I think people a lot of times don't realize its potential to do harm. One of the things that I learned recently that I didn't know about was if you're heavily addicted to alcohol to the point where you need a drink every day, quitting cold turkey can be very dangerous. It can be fatal, in fact. Do you want to talk a little bit about that?
Absolutely. So that's so true. Everything you said is so true about alcohol. It's one of those things that it's hard to kind of for people to accept when there's an addiction to it, because there's quantities that one person may be able to consume and never feel certain effects to versus someone else, there's like, okay, well, I'm only drinking this much, or I don't drink all the time or every day. But like I say, go back to those components of how it's affecting your life and your physical and mental, not just physical health, but mental health. Then you have a use disorder. That's when you start classifying that. There's an actual criteria to make those classifications, which we call the DSM-5 criteria for a substance use disorder. But when it comes to the withdrawal symptoms of alcohol, a lot of people kind of don't realize what's going on until they're too late. But sometimes the earliest sign of it could be those too late signs. So, but some of the most common symptoms of withdrawals are, sometimes they're getting some nausea or upset stomach, diarrhea. Well, sometimes drinking itself can cause people to have that, so they don't realize it's a withdrawal symptom. The hangover itself will cause you to have the headache. So, but the withdrawal symptom itself can be accompanied by headaches, blurry vision, or changes in vision. Okay. It can be accompanied by, sensitivity to light and sound, anxiety and agitation and restlessness. Those are things that sometimes people are using the alcohol to make better. The sleeplessness, having insomnia. Sometimes they're drinking to make those things better, but don't realize when they're not drinking, the drinking is making it worse, because when they don't have that drink, it gets more severe.
Interesting. Yeah.
A lot of people get more. Most of the time, the only symptom that a lot of people that a lot of people know is the tremors. Most people think that tremors means withdrawals, but all those other things they don't really associate with withdrawals. Well, the tremors is usually a telltale sign, but it's not the only sign. And then when you're thinking about more severe signs is when people start hearing things that no one else is hearing. Hallucinations, seeing people, or seeing things that no one else is seeing.
Really? So
those hallucinations are usually getting a little bit more severe. Then we get into the technical stuff like delirium tremors, and to the point where you can get into seizures, to the point where you can get into a coma, to the point where you can die. So it can be fatal going into alcohol withdrawals. They are very closely related to benzodiazepine.
Okay.
I call them sisters. Benzodiazepines and alcohol are like sisters. The symptoms of withdrawals are very mimicking. The symptoms of intoxication is mimicking. I think the biggest difference is how they affect the liver. The alcohol is more unfriendly to the liver, and benzos are a little bit more unfriendly to the mind. But other than that,
Yeah. And how many times have we heard someone say, I need a drink to relax? I mean, that's, so true. And I here again, I learned so much just with what you said there. That's very interesting. When it comes to MAT treatment, how is it implemented? And kind of, I'm not sure, do people have to get referred into the system? I'm kind of curious as to how people get into it. And then the other thing, we'll talk a little bit more about stigma here in a minute, but there is accountability for someone who's under this treatment to make sure that they're not still using. And I just kind of wonder how you balance that out.
Yeah. So when it comes to getting services, there's so many different ways that people are referred, but then people can come off the street and just come in. Like, for instance, at our CommQuest Market Avenue office, they can come in for an assessment. Usually the process is coming in for an assessment with our counselor, and they determine, the need. So they have a technical term, ASAM criteria, to see where you fit in that box of services. So if they do, diagnose you with that substance use disorder, most commonly we do the alcohol use and opioid use. Those are the MATs that we have specifically that have been FDA approved. So they send them down for an appointment with the medical team. They'll get a nurse evaluation, and then they'll see either myself or our nurse practitioner who's also doing our MAT services. Okay. But the process is really simple. Anyone can walk off the street to do it, or a lot of people, we do get a lot of referrals. We get jail referrals. We get referrals from other facilities who people think that all of the providers are in competition. We work together a lot. Sure. So we'll get referrals from there. No two companies are going to offer the exact same services. And sometimes people are better served at one place than the other. And they're constantly working together to make those determinations. It can be just a matter of which street you live on. We service a lot of the underserved. So if you're walking distance to one of our, I won't even call them competitors, one of our community partners. Yes, community partners, then we'll, refer you over there and vice versa. They may be walking distance and easier to get there. And it's sometimes a matter of insurance or location preference. But we try to work together. Community partners, I like that word. But when it comes to people walking off the street, we do get a lot of people that way, but a lot of referrals as well. So anyway, we take anyone who comes. Okay. So.
Now, during the treatment, do you monitor the clients with drug testing or anything to make sure that their system is clean?
Yeah. So accountability is a big thing. I always like to, and this is one analogy that I stole from a vet in the game that I've worked with years ago. It's like playing tennis. And when it comes with the client, you don't want to be the only one swinging that racket. Yeah. So, it takes a lot of work trying to, like I said, this is kind of like customizing the treatment for them. So determining that right dose of the medications, we're treating their mental health meds as well. We're trying to tailor those services. And so even our counselors, we're all working together as a team. Even if we're not sitting in the same room together, we're working together as a team. We're in constant communication about our clients. After each appointment, we're usually, teamed in each other if there's any issues. Sometimes it's trying to coordinate transportation for them. But when we're serving that ball over to the next side, we expect the clients to serve it right back over. Absolutely. So it's going to take work. It's not just taking a pill every day and just waking up and say, I'm in recovery. Every single client that comes in for MAT gets set up with the counselor. We even have a process of orienting them so they can be comfortable with the facility, knowing the do's and don'ts, knowing what's expected of them. And they sit down and have that for at least an hour of orientation. Sure. Every single one gets drug screened. We have random drug screens, so that kind of keeps up the accountability. Everyone has a color they're assigned. So there's a message that goes out every morning. And it's like, today's your color. And they have 24 hours to get in and give us that screening. And then, of course, there's some people, we have people on different different medical complications. So we work with people. There's some people who are traveling a little further, so we might give them a little more time. Like, okay, we'll get here by this time. But we'll if they're unable, we have some people who are in wheelchairs or with disabilities, so we accommodate them with different types of screens if they're unable to give us urine screens. And then we also have our nurse team who will kind of counsel them on their medications and different things that they're expected to do while they're in the program. We offer ILP groups. That's an intensive outpatient program, and that's there's like a curriculum they go through. They'll meet a couple of hours each day or like 3 days out of the week. And it's more than just, to me, I think it's more than just recovery, just addiction information. It's more like geared towards living, period. It's almost like life coaching to me, the ILP groups. They tell you how to, it's like managing life in general. I've sat in a couple of groups and I felt like I got something out of it myself.
Sure.
And then we have some more less intensive groups that are kind of like that, but not as intense. And you're with a group of people, so you get to share each other's ideas and experience without the settings of feeling like you're in like an AA meeting. But also we do encourage people to go to meetings because that's very beneficial for a lot of people in recovery, to be able to go to things like what we call 12-step meetings. So we get people engaged in things like that. We have family support groups. We have case management offered to some of our people. So those social components, that mental health component, and the medication, they're all there, one spot, working together. We even have special programs for moms, and now it's been extended to fathers. Mm-hmm. So women who are pregnant, we're literally taking care of everybody. So
that's great. And that kind of, my next question was about follow-up treatment, but it's very clear that this is all part of a comprehensive thing that involves mental health, lifestyle, and it's not just like giving them a pill and they come by and they get a pill or whatever, and then they go on their way. This is much more comprehensive than that. And that kind of leads into the stigma, because one of the stigmas that myself and a lot of the marketing people, we go out and we talk to the public at certain events, and people will come up, and most people are very friendly, sometimes not so much, but in all, there are some misconceptions about certain things that we do. And one of the ones I hear in regard to, this type of treatment, this MAT treatment as well, it's just replacing one drug with another. And I don't think people realize that this isn't just them stopping by and us giving them a dose of something and sending them on their way. This is part of a comprehensive treatment. So do you want to talk a little bit about the stigma about that?
Absolutely.
Yeah.
So it's that, and a lot of different stigmas when it comes to MAT has existed. But I have this conversation with people constantly, and that stigma has been there for a very long time, since MAT has been in existence. The misconception, the only medication that the buprenorphine and methadone is not the only medication when it comes to opioids. The naltrexone is also there, not just for alcohol, but also for opioids. So for some people who are just adamant about not using another opioid, the naltrexone is also available. And that is not a controlled substance. It doesn't show up on any urine drug screen. And it's not it's a complete blocker. It's not an agonist. However, when it comes to the purpose of that methadone and the purpose of the Suboxone is to occupy what we call those receptors in order to allow those to, like I said, let that brain time, give it brain time to heal. So it's like telling a diabetic that when they take their metformin or take their insulin that you're not a controlled diabetic. Well, when you're needing insulin, do you deprive the diabetic of insulin? Yeah. Or do you say, oh, well, you're not, you're not controlled because you're dependent on the medication? And that's the difference between a dependency and an addiction. You don't become addicted. When taking the right way, you're not addicted to Suboxone or methadone. Now, You can abuse a lot of medicines. You can abuse sleep medicine. You can abuse Benadryl. Some people abuse diabetic medication. Some people abuse insulin to lose weight. So a lot of things can be abused. Some people abuse laxatives to lose weight.
Sure.
And that's probably one of the gentlest things that with least side effects other than what you wanted to do, make you use the bathroom.
Right.
So, but when it comes to these, one thing about MAT, proven benefits to decrease opioid use, to decrease opioid-related overdoses. It decreases criminal activity in communities. It decreases infectious disease transmission and increase social functioning. So when you compare MAT to things out there on the street, it's a no-brainer to me. Like when you become, I don't see anyone going to a dealer and saying, give me my half a gram of, and some people can calculate and know that, okay, well, I'm only doing a half a gram of fentanyl every day, but they've lost their job, they've lost their kids, they've lost their car, they've lost their home, and they get on methadone, and regardless of what dose they might be bouncing around on for however long, I have my own personal client who has went from that point, who went from living out of a restaurant bathroom, who is now a successful owner of his own business and getting married and owns his own home and on methadone. That's the difference.
Yes. There's a lot. Obviously, Ohio has been one of the hotbeds for what's been called the opioid crisis. You hear a lot about fentanyl now. And there's these horrible stories that I've heard about the zombie drug, which is a form of a horse tranquilizer, from what I understand. So in light of what the news that people are hearing, is there light at the end of the tunnel? What would be your message of hope for people who hear these stories about addiction and may have a family member who's suffering with it? What would be your message of hope?
Listen, we're not stopping, so you don't stop either. The people who are working in the community to eradicate this epidemic, because it is, we're not stopping. And no matter how much stuff they throw out there on the street, no matter how many things they want to design, how many things they want to manufacture and put into these substances, we're just going to keep battling it. And we're here to help you battle it. We're not giving up. And you don't give up either. And there's no, like I said, there's no cookie cutter solution on how to recover. It's a chronic, recurring disorder. It's chronic and it's recurring, meaning we fall down, we get back up, we keep pushing. So no matter how many times you feel like you've tried, don't give up, because you'll just get better at it. You'll get stronger. You'll go longer. And we're going to be here. We're not going anywhere.
Awesome. That is a fantastic message. We have been talking to Dr. Ashlie Martin, who is our medical director here at CommQuest. Thank you so much for coming in and sharing this information. It was a little both. You shared a little bit of your personal journey, which is always so impactful and so courageous on your part. Thank you so much. And the information, so valuable. Thank you so much for coming in.
Thank you for having me.
Absolutely. You've been listening to the Hope Discovered podcast by CommQuest. If you would like more information about our MAT program or any of the things that we do here at CommQuest, I would direct you to CommQuest.org. And once again, that is CommQuest.org. Thank you very much for listening to our podcast today, and we will talk to you again very soon.